Hi there, welcome back to the channel. We're going to talk today about all the crazy things that can happen after you have your baby, just when you think you're out of the woods. Thing number one, blood clots. Blood clots can happen in pregnancy just because your blood is a little bit more hypercoagulable in pregnancy. And I think this is nature's way of keeping you from bleeding too much when you have your baby. So whether you deliver vaginally or by C-section, the rate of blood clots after you have your baby is in the neighborhood of 1 in 1,000, but that risk goes way up if you have risk factors. For instance, if you're a smoker, your risk is very much higher. If you have an underlying clotting abnormality, your risk is higher. With a cesarean delivery, the risk is higher. And if you don't get up and move around, the risk is a lot higher. So how to avoid blood clots in pregnancy? One, get up and move. It hurts to move after you have a C-section, but you'll be so much happier after you've done it because you get better faster. The risk of blood clots go down, you heal faster, your appetite comes back faster. So even though you have to kind of grit your teeth and force yourself to get out of bed, you'll be so happy that you did. Thing number two, preeclampsia. Most preeclampsia happens before you have your baby. In fact, sometimes that's why you have your baby, because if you develop elevated blood pressures toward the end of the pregnancy, then oftentimes we want you to have your baby because then the risk goes way down and your blood pressures get better. But 5 to 10% of the time, preeclampsia happens in the first month after you have your baby. So when you go home, if you have symptoms of headache, abdominal pain, especially up high under your ribs, and your swelling increases, those are warning signs for preeclampsia. If you have a blood pressure cuff at home, check your blood pressure. It should be less than 140 for that top number and less than 90 for that bottom number. And if your blood pressure is elevated, make haste and go to the emergency room and or call your OB provider. And if you go to the emergency room, be sure and let them know that you just had a baby, because that changes things. If you have a headache and you go to the emergency room and they don't know that you were recently pregnant, they might just treat your headache and let you go home. But headaches in relation to pregnancy can be much more serious. And we treat preeclampsia after you have the baby the same as we do before you have the baby. In other words, we admit you to the hospital, we start magnesium in your IV to help keep you from having complications like seizures and strokes, and we watch your blood pressure and give you medicine to help bring your blood pressure down. Most of the time, it goes away very quickly and you'll be back home with your baby before you know it. The third thing to watch for is symptoms of depression, anxiety, and even psychosis. So your world gets turned upside down when you have a baby. You're not sleeping. You may not have time to eat or take a shower, but for a number of women, it's more than that. And in the first few weeks after delivery, if you feel like you are not eating or drinking normally, or you're having trouble just coping with everyday stresses, or if somebody that is close to you tells you that you're just not acting like yourself, listen to them and get that checked out. At every postpartum visit, your OB provider is going to screen you for symptoms of depression and anxiety. And for most women, any symptoms go away after the first month as you get more used to caring for your baby and getting used to your new schedule. But for some women, this doesn't happen and they need extra help in the form of counseling or therapy or medication. There are so many things that are safe for you to take in pregnancy and while breastfeeding that you should not hesitate to reach out if you're just not feeling up to snuff. An additional word about mental health care in pregnancy. Mental health is health. You deserve to feel good, and you're not being a bad mom by reaching out and asking for additional help in the form of therapy or medication. This is going to make you a better mom. Taking care of yourself is the first step toward taking good care of your baby. Next up, number 4, diabetes. When you have diabetes in pregnancy, especially if you have gestational diabetes, you think you're done after you have your baby, and in many ways you are, because most of the time your glucoses come right back down and it gets so much easier to have normal glucoses. But don't forget, 60 to 70% of women with gestational diabetes become diabetic or stay diabetic. So this should not fall off your radar. I know you've got a lot going on after you have your baby, but continue to eat well. You can definitely relax a little bit, but you should have another glucose test at one of your postpartum visits. Hopefully your OB provider will remember this. And if that's normal, then every 6 months to a year after that, you should have a test called an A1C, which is just a blood draw that looks at your average blood sugar over about a 3-month period of time. And if that is starting to trend up into the pre-diabetic or diabetic range, then you need to get busy again and be diligent at how you eat and follow up with your primary care provider. The fifth complication I want to talk about is called peripartum cardiomyopathy. And this is heart failure that happens in otherwise healthy women. And by definition, it occurs anytime between the last month of pregnancy and the 6 months after delivery. And it causes symptoms of heart failure that you would see in an elderly person: shortness of breath, a wet cough, swelling up. And so if you have these symptoms, if you suddenly start to swell up more, and especially if your blood pressure is normal to mildly elevated, you need to be evaluated for this condition because it is potentially life-threatening. And the way we make the diagnosis is usually with labs and chest x-ray, and especially an echocardiogram or an ultrasound of your heart. And if we find that your heart is not pumping like it should, then that kind of gives us the diagnosis, and we treat it like we would anybody else with heart failure, and usually outcomes are good. Back in the day when I was training, we would tell people who had cardiomyopathy, never get pregnant again. The recurrence risk is very high, and you could die if you become pregnant again. Now we kind of stratify that risk, and we recognize that not everybody with cardiomyopathy has the same risk of recurrence or complications. So if you recover heart function within a few months after you deliver, then you might be a good candidate to try again for another pregnancy. But if you have persistent cardiac dysfunction that extends more than 6 months after you have the baby, then you might not want to get pregnant again, because the risk of recurrence or the risk of heart failure with a subsequent pregnancy could be much, much higher. So those are the big 5 complications that can happen after you have your baby. Of course, there are many more. You could get run over by a bus, but most of the time you just need to watch for these 5 things. So remember, get up and move after you have your baby. Eat healthy, because your diabetes may be lurking right around the corner. And if you have symptoms of headache, swelling, shortness of breath, or anything that develops suddenly and just doesn't feel right to you, call your provider. Always better to be safe than sorry. Thanks for watching. See you next time.